Assalamu alaikum everyone. My name is Irtaza, roll number 2021 DVM evening 050. Today I will be discussing a case presentation of management of a canine prostate abscess. In this case study, we will discuss what is a prostate abscess, its clinical signs, and its treatment. So let's discuss what is a prostatic abscess. Prostatic abscess is a localized pocket of purulent fluid inside the prostate gland. It is the accumulation of purulent fluid in the parenchyma of the prostate. It usually develops when bacteria enter the prostate. The common routes to enter the prostate are through ascending infection through urethra or urinary bladder, although hematogenous spread is also possible. Usually the prostatic abscess is a case of older dogs. Older intact male dogs are affected by prostatic abscess. Let's discuss the case that was presented. The case presented was of an 8-year-old intact male dog, Labrador, which was brought to the veterinary clinic with complaint of hematuria for 4 days and a 2-month history of perpetual swelling. And recently the dog also began dribbling urine. On clinical examination, it was found that the abdomen was distended. The dog had difficulty in walking, and on rectal digital palpation, the dog felt pain, which indicated a swollen or enlarged prostate. Diagnostic techniques were employed to diagnose the case. Ultrasonography was used, and 3 cavities was found inside the abdominal cavity. One of the cavity was urinary bladder that was confirmed by catheterization and inserting normal saline into the bladder while monitoring ultrasonographically, and the other 2 cavitations, anechoic cavitations with hyperechoic margins, were prostatic abscess. Further clarification was made using cytopathology. Ultrasonographically guided aspiration was done, and the fluid was sent to the lab for the cytopathology. The Giemsa stain smear of the fluid was packed with a mixed bacterial population of Diplococci and Streptococci species. Also, inflammatory cells, mostly neutrophils and pus cells, were found. Complete blood count elicited leukocytosis and neutrophilia, which confirmed that as a case of prostatic abscess. For the treatment of the dog, 3 ultrasound guided drainages were done, each at 3 days apart. About 200 ml of purulent fluid was removed. For antimicrobial therapy, enrofloxacin was given intramuscularly at dose of 5 mg per kg for the twice daily for first 3 days. After that, it was followed by levofloxacin at the dose of 5 mg per kg orally for 21 days. To support the repair and inflammation, trypsin chymotrypsin was given orally for the first 5 days. Additionally, liver spot syrup was also given. After the treatment, the dog responded well. The symptoms began improving within 3 days and completely within 2 weeks. Further, the owner was advised for castration because the castration would reduce the risk of a reoccurrence of the prostatic abscess. That was the case of a prostatic abscess in canines and how it can be treated and how it can be prevented. Castrated dogs are at a lesser risk of prostatic abscess than the intact dogs. Thank you.